Hello everyone, I am Dr. Tejinder Singh. I am a senior medical oncologist practicing in Apollo Hospital, Navi, Mumbai. Today we will discuss about patients who are taking chemotherapy, those who have finished chemotherapy, and the scenario which we are facing right now regarding the Omicron variant of COVID. So as we know right now in India, the third wave is going on. We are seeing every day number of cases increasing, not only in Mumbai but rest part of the country also. So what we are today I'm going to discuss is what kind of precautions which we should do, what kind of test is required in order to justify whether we need to treat these patients, my cancer patients, as early as possible or not. So one thing we know that COVID and cancer have got no relation. Omicron variant is highly infectious. A single person can infect many people, and luckily the good thing which has happened is the infection, the intensity is not so high. It is not affecting so much lung. It is causing fever, and but the fever used to subside in 2-3 days. So, and this Omicron variant has we are not seeing too much of oxygen usage, and also and patients who have already got vaccination, the probability of they also get infected, but the severity is very low. So one thing which we have been stressing everyone is that even if you are taking chemotherapy, the vaccination is a must. Vaccination should be done. There are certain patients like lymphoma patient where vaccination will not bring about too much of antibody response, but yes, vaccination should be possible. Wherever it is possible, we should vaccinate our patient. So vaccination is very important. Taking a double dose is what we are looking at it, and the patients who are due for the booster, they should also go ahead and take the booster. Now, like any COVID infection, the important thing for COVID is that it's highly infectious. So we have to keep we have to maintain a personal hygiene. We know that most of the people are using the mask, and also they are doing hand wash. If any patient in a house develops fever, even common cold also, he should isolate himself so that the other person should not get infected. Remember one thing, COVID luckily is not so severe, we are able to manage, but they have to take the guidance from their COVID doctors, and they have to also keep their oncologist also in the loop what kind of treatment is to be given. Most of the patient, they do very well, nothing happens, so we should not be afraid. A general basic personal hygiene and trying to see managing the oxygen level, trying to check the blood pressure level and pulse. These are the things which are very important for managing Omicron COVID patient. And other thing is that taking unnecessary medicine like antibiotics should not be taken without consulting a COVID physician. That's my humble request to everyone. Thank you.